In December 2019, China notified the World Health Organization of several cases of human respiratory illness, a disease later named COVID-19. The virus causing this disease is known as severe acute respiratory syndrome coronavirus 2. The disease spreads through small droplets that are expelled from the nose or mouth when a person with COVID-19 coughs or exhales. Therefore, standing close to someone who is infected can put you at risk. These droplets can land on your hand and be transmitted through something as simple as a handshake if afterwards you touch your eyes, nose, or mouth, the so-called T-zone. The virus is known to survive on different types of surfaces, so touching these contaminated surfaces and then touching your T-zone brings a high risk of infection. What we know so far: the coronavirus is spherical in shape, and its genetic material is encapsulated by different types of proteins. Some of the key structural ones are spike S protein, the most prominent feature of coronaviruses from where they get their name, then M, or membrane protein, and the so-called envelope protein.
The first case of novel coronavirus was reported in Wuhan, China in December 2019. Early cases were believed to be linked to a live animal market in Wuhan and have since been spreading from person to person. Shortly after, cases of the virus began to appear outside of China, and on January 20th, 2020, the first case of novel coronavirus was reported in the United States. On January 30th, the World Health Organization declared the outbreak a public health emergency of international concern.
More cases should be expected in other parts of China and possibly other countries.
Coronaviruses are a large family of viruses, named for their shape, protruding spikes that look like a crown or a corona. SARS and MERS are part of the coronavirus family, as well as viruses that cause the common cold. The 2019 novel coronavirus was officially named COVID-19 on February 11th by the World Health Organization. Suspected community spread was first reported in the United States on February 26th, with no known links to people who've traveled to Wuhan, China. WHO said on February 27th that COVID-19 has pandemic potential.
This virus does not respect borders.
COVID-19 can cause flu-like symptoms that range from mild to severe, including cough, fever, and shortness of breath. Since the infection can include symptoms similar to pneumonia, influenza, and the common cold, only a diagnostic test can confirm whether or not an individual is positive for the virus. Thousands of people have died around the world. The first deaths in the United States occurred on February 26th. There are trials underway for treatments, but vaccines are still in the development phase and likely more than a year away. CDC officials say that Americans should prepare for major disruptions to their daily routines. Recommendations to reduce the risk of infection include regular hand washing, covering mouth and nose when coughing and sneezing, avoiding close contact with anyone showing signs of respiratory illness such as coughing and sneezing, avoiding touching your face, disinfecting frequently touched objects and surfaces, using an alcohol-based hand sanitizer if soap and water aren't available. If you're sick, stay home. If you're experiencing severe symptoms or are worried that you've contracted the virus, call your doctor before going in.